Okay, so the idea is to talk about chylothorax, which means that there is chyle, which is usually fluid that comes from the lymphatic system, usually comes from the digestive system, and drained throughout the lymphatic system. And instead of going to the circulation, it goes to the pleural space. There it looks like milk with fat and uh, cells of the immune system, and instead of going to the systemic circulation, it goes to the pleural space between the visceral and parietal pleural in the lung. Of course, there is some pathological cause in it. Not always it can be found, but it can be from something that compress the lymphatic system, the thoracic duct, for example. Something block the thoracic duct, and it can cause the fluid to just get out to the pleural space. So, what can cause it? For example, a tumor that compress the thoracic duct or damage the thoracic duct, surgery that cut the thoracic duct, they block the thoracic duct. So, and sometimes it's unknown cause, but all of those pathological things can cause those milky substance, those chyle with kilomicrons, fats, nutrients, and white blood cells to get out of the thoracic duct into the pleural space and accumulate them and cause pleural effusion, which is chylothorax. This pleural effusion is from chyle, so it's chylothorax. If you drain it, it will be like a milk. So now, if it compresses the lung, as any pleural effusion, it can cause symptoms of shortness of breath, feeling of tightness, chest pain, cough, everything that can cause respiratory distress because of this compression, because of this fluid in the pleural space, which inhibit the lung to move as it's needed. Now, there are also other complications that can be caused by too much of lymphatic fluids being lost. So you can lose fats, triglycerides, you can lose nutrients, you can lose lymphocytes, you can lose immunoglobulins. Remember that these fluids comes from the digestive system and it throughout the lymphatic system. So lymph substance and digestive substance are lost. So you can have a complication from lack of this substance in the body. Now, diagnosis is throughout imaging, is throughout history, is throughout if you are doing fluid analysis, you will see that there is high levels of fat, especially we're talking about triglycerides, usually above 110 milligram per deciliter. You will see kilomicrons, you will see milky appearance sometimes if the chyle concentration is high enough. So this is how history, this is how, for example, if you went surgery in his thoracic cavity, this is how the fluid analysis, this is how the imaging, all of this comes together and we are getting to the diagnosis. Now the treatment, it depends, sometimes conservative treatment with a dietary modification, low fat diet, and sometimes some medications. For example, I heard about octreotide, somatostatin, I have no idea, but that's what I heard, that can be given. And sometimes it's not enough, so surgery for repairing the something that is blocking or something that is stirred or whatever caused the problem. If, for example, lymphoma compress the thoracic duct, you need to take the lymphoma out of there. Of course, thoratosynthesis, like doing for pleural effusion, I mean, draining the fluid can help relieve the symptoms of the patient until the source is corrected, or if the source is temporary, so maybe it will be enough. Now, of course, the prognosis depends on what caused it. If the patient had, I don't know, metastatic lymphoma stage 4, the prognosis is not very good. But if it's something temporary and the patient is okay, it may be even treated early, it's maybe okay. So, but don't wait for it to develop complications. I mean, if the pleural effusion is very big from this chylothorax, of course, it can cause respiratory symptoms. And of course, if you wait too long and it continue to accumulate there, it will cause lung collapse and the patient won't be in a good position, won't be in a good state. So early diagnosis, early treatment is better. Also, the patient can have loss of lymphatic fluid, so it can have the patient may have he will lose immunoglobulins, so it may impair his immune system. He loses fat and nutrients, so it may cause him malnutrition. Of course, I'm talking about something that's very, very massive. Okay, that's it. That's about chylothorax and the things around it, not just the chylothorax itself. Think about where it comes from, the thoracic duct that takes the fluids from the digestive system and should give it to the systemic circulation. It's important to understand this anatomy and physiology because the complications are related, and the diagnosis, which is based on, for example, fluid collection from drainage, you will look for the chylomicrons, you will look for the fats, you will look for the high triglycerides. So remember the logic of this pathology. Think about the cause. What is the cause? What compressed the thoracic duct? Maybe there was surgery. What should be done? Should you drain this fluid? Of course, it can cause complications, even from just fluid, because it compresses the lung. There are treatments. Sometimes conservative treatment is enough, and sometimes you need to do an intervention to treat and to repair what is causing the problem. And that's it. This was about chylothorax. Thank you very much, and that's it.